Hello everyone, my name is Jayla Hilton, and today I will be presenting my evidence-based practice project focused on improving outcomes for adults with type 2 diabetes through diabetes self-management education, commonly known as DSME. Type 2 diabetes remains one of the most significant chronic diseases affecting adults in the United States. According to the Center for Disease Control and Prevention, more than 38 million Americans have diabetes, and approximately 90 to 95% of those cases are type 2 diabetes. Diabetes is associated with serious complications, including cardiovascular disease, kidney disease, neuropathy, retinopathy, and premature mortality. In addition to the human impact, diabetes places a substantial financial burden on the healthcare system through increased hospitalizations, emergency department visits, and long-term treatment costs. The management of type 2 diabetes requires more than medication alone. Successful treatment depends heavily on patients' ability to make daily decisions regarding nutrition, physical activity, blood glucose monitoring, medication adherence, and lifestyle modification. Unfortunately, many patients do not receive adequate education or support to effectively manage their condition. As a result, poor glycemic control remains common, leading to preventable complications and decreased quality of life. For this evidence-based project, the identified practice problem is inadequate diabetes self-management among adults with type 2 diabetes in the primary care setting. The proposed intervention is to implement a structured diabetes self-management education program to improve glycemic control and overall disease management. The theoretic framework supporting this project is the health belief model. The health belief model suggests that health-related behavior changes can occur when individuals recognize their susceptibility to a health problem. Understanding the severity of the condition, perceive benefits from taking action, and identify strategies to overcome barriers to change. This framework is highly applicable to diabetes management. Patients who understand the risk associated with uncontrolled diabetes, including blindness, kidney failure, cardiovascular disease, and many more, they may be more motivated to engage in those self-management behaviors. Diabetes self-management education helps patients recognize these risks with simultaneously providing practical skills and confidence to manage their condition effectively. Through education, support, and empowerment, patients have become active participants in their health care rather than passive recipients of treatment. Evidence strongly supports the use of diabetes self-management education as an effective intervention for improving glycemic control. Our first study was conducted by Shvala and colleagues in 2016. This systemic review evaluated multiple diabetes self-management education interventions and found consistent improvements in glycemic control among other participants. Patients who participated in the DSME programs demonstrated significant reductions in hemoglobin A1C levels compared with those receiving usual care. The researchers concluded that DSME is an effective strategy for improving diabetes outcomes and improving self-management behaviors. The second study was conducted by Powers and colleagues in 2020. This evidence-based review examined national standards for diabetes self-management education and support. The authors found that patients who received structured education experienced improvements in self-care behaviors, medication adherence, and diabetes knowledge, quality of life, and clinical outcomes. The review emphasized that ongoing education and support are essential components of effective diabetes management. The third study was conducted by Cunningham and colleagues in 2018. Researchers evaluated the impact of diabetes education programs on glycemic control and patient engagement. Their findings demonstrated that participation in structured educational interventions was associated with improving hemoglobin A1C levels and greater confidence in managing diabetes-related behaviors. Patients who actively engaged in education sessions were more likely to achieve treatment goals and maintain lifestyle modifications over time. Collectively, these studies demonstrate that diabetes self-management education improves patient knowledge, promotes healthy behaviors, enhances that self-efficiency, and contributes to better glycemic control. The evidence consistently supports DSME as an effective intervention for adults with type 2 diabetes. The project implementation plan follows the Johns Hopkins evidence-based practice model. The target population includes adults 18 years of age and older who have been diagnosed with type 2 diabetes and received care within a primary care practice. Patients' identification will occur through electronic health records review and provider referral. Existing patients diagnosed with type 2 diabetes will be eligible for participation as well. There are oftentimes we have patients who are not well educated in having diabetes, and they've had it for years and years and years. So I feel like this will be of a huge benefit. Additionally, individuals identified as high risk through the American Diabetes Association risk test can be referred for further evaluation and education. The planned intervention will consist of a structured diabetes self-management education program delivered over a 12-week period. Educational sessions will focus on diabetes pathophysiology, medication management, blood glucose monitoring, healthy eating, physical activity, compliance prevention, complication prevention, and goal setting. Participants will receive educational materials consistent with the current American Diabetes Association recommendations. Sessions may be conducted individually or in small groups, depending on available resources and patient preferences. Follow-up support will be provided to reinforce educational concepts and encourage sustained behavior changes. Evaluation of outcomes will focus primarily on glycemic control. Hemoglobin A1C levels will be obtained at baseline and again at the completion of the 12-week intervention. Additionally, measures may include patient self-reported adherence, attendance rates, and confidence in diabetes self-management. Our anticipated outcome would be a measurable reduction in hemoglobin A1C levels following participation in the diabetes self-management education program. Secondary outcomes include improved diabetes knowledge, increased self-management behaviors, and enhanced quality of life. The implementation timeline spans approximately 6 months. Month 1 will involve planning activities, stakeholder management, and project approval. Month 2 will focus on staff education, development of educational materials, and participation recruitment. Months 3 through 5 will include delivery of the 12-week diabetes self-management education intervention. Month 6 will involve collection of outcome data, analysis of findings, and dissemination of results. This timeline provides adequate opportunity to implement the intervention, evaluate patient outcomes, and determine the effectiveness of the project. In conclusion, type 2 diabetes remains a significant public concern associated with substantial morbidity, mortality, and healthcare costs. Effective management requires active patient participation and ongoing support. Diabetes self-management education is an evidence-based intervention that empowers patients to take control of their health, improve self-management behaviors, and achieve better glycemic control. Guided by the health belief model and supported by current research evidence, this project seeks to improve outcomes among adults with type 2 diabetes through a structured education intervention. By enhancing patient knowledge and self-efficiency, diabetes self-management education has the potential to reduce complications, improve quality of life, and support long-term disease management. Thank you for your time and attention. I look forward to your questions and feedback.